Everything from birth control pills to the morning after pill will soon be free of charge to American women. Welcome back, everyone. Under President Obama's health care plan signed into law last year, private insurers will now be required to provide women with a whole range of preventative services, all free of charge, no copay. Starting on August 1st, 2012, tens of millions of insured women are expected to gain free coverage to services like, well, women visits, screening for gestational diabetes, domestic violence screenings, and all FDA-approved birth control methods, including morning after pill. Now, that has some conservative and religious groups shaking their heads.
For the majority of pro-life Americans who are not in favor of that, this shouldn't be something that's mandated into insurances.
Okay. Meanwhile, Secretary of Health and Human Services says it's just like covering the flu shot. I want to bring in the table and see what you folks think here. Michael, I'll start with you. I take you're not crazy about this.
Well, I just want to remind everybody, I want to remind the listeners and the people watching the show, there is nothing for free. It will be paid for on your insurance policy. It will be paid for with your taxes. There is nothing for free, and the government is really overstepping their boundaries in doing and making this a mandate.
But are you concerned about the cost? Are you concerned about, for people who object to it, they shouldn't underwrite it?
I think I'm concerned about two things, the cost and also the morality of the fact that why should people who don't believe in the morning after pill and performing birth control and abortions, why should taxpayers have to pay for that, or why should other people who have insurance policies have to pay for that?
Nancy?
I'm very happy about it. I did a little dance, a little celebratory dance, because I think that women's rights and women's reproductive health and their choices are something that are as American as Viagra or the flu, as it was said. It's funny to me how certain health choices are somehow to be made by the government when it comes to like abortion and whatnot, but the same people that want to make decisions about what a woman does reproductively don't want government controlling other things. There's things that I don't care for that are covered by my tax money, and this is something that I do care for. I think everybody has it, you know, a little bit of each.
Jeannie?
Well, you know me, I think anything free for women is good. So I am all for it. I think Michael's right about the cost issue. I mean, there is nothing for free. That said, I mean, I do agree that, you know, listen, women, we have, you know, coming down the pike, we have birth control for men. Men, get ready. Will or that be covered or will not?
Right?
And
Viagra's
Viagra is covered. So in fairness to the women, those things should be covered, and we all pay for a lot of things that we don't support
Aren't
from
there
a moral
exceptions,
perspective.
guys, into
but
this?
this isn't going to be free.
Aren't there exceptions put in this for religious institutions that they don't have to opt in effect?
I'm not sure of that.
I believe there are.
Yeah,
I'm not quite
there's
sure of that.
some people want them more widespread, but Michael, honestly, did you see that this day was coming? Maybe you didn't think 2011,
No,
but
I
there
saw
was
this
inevitability
day
of it.
coming, and I think it's the road, the wrong road that we're on. You know, we were at a fork in the road, and when we made the left-hand turn, and when people sit home and come over to your house and have a visit and complain about the health care costs and their insurance policies, this is all part of it. Every mandate that's put down upon either the taxpayers or the private sector.
Could I argue, though, on a social thing, I'm not going to get into dollars and cents, that if you provide birth control and there isn't a cost to entry of it for some folks, you're going to cut down on unwanted pregnancies and abortions.
How about some responsibility and some common sense? And how about some, you know, understanding that we're all responsible for our own actions?
Yeah, and
I think we've lost that that thrust here in the country.
But I think this is a way for someone who wants to be responsible for their actions, and it comes right down to dollars and cents.
How are you being responsible for your action if I'm giving you a bag full of day after pills that we can do whatever we want with it, and because I'm going to give you the day after pill.
It prevents an unwanted pregnancy, which may prevent another mouth to feed when it comes to welfare or taxes.
Well, then
or
how about
if you
Here's
really
the
want to
problem,
boil
though.
it down to that, I mean,
this is
you know.
only
How
for
about dealing with
insured
some
women, and a lot of the women who need this assistance are not going to get it because they are uninsured,
I
which
think
is
the
a
argument would be
huge
it
policy
starts
problem.
somewhere
Yeah.
on
Well,
the thing. But you know,
but-
I
And
have
they'll be
to
able
say
to
on
get
this one, I
insurance
do
in
understand
Well,
both
maybe,
sides of the
maybe
argument,
not.
and I have a strong feeling nobody's going to convince the other one of the other side of the opinion on this one.